This is a staggering number that all of us should be paying more attention to. More Americans died of drug overdoses in 2021 than any previous year ever. And now new numbers are showing one state that has enacted a drug treatment program to help fight addiction has made things possibly even worse. Alex Capriello live in Culver City. What reportedly is the cause of this increased rate of drug abuse, Alex?
Well, America is certainly in a state of crisis right now. That's no exaggeration. As you mentioned, the CDC reporting for the very first time ever, Adrian, more than 100,000 Americans have died from drug overdosing. That's a 30% swing from the year before. And it's related to a number of factors, but it is across the board. When you look at it, we're talking about cocaine, opioids, prescription meds, and fentanyl all up.
This is no longer one of those things that happened to that person. It's a thing that's happening to everyone.
Matt Sutton with the Drug Policy Alliance points to two triggers for our record drug abuse in America. One, the pandemic forced people into isolation and depression, so drug experimentation and addiction followed. And two, the rapid takeover of fentanyl, a highly addictive synthetic opioid. Look at this map. The Northeast has the highest number of overdose deaths, but it's the Northwest, states like Washington and Oregon, that are experiencing the sharpest swing of fentanyl-related ODs.
We see more people in need and people with fewer resources.
In November 2020, Oregon passed Measure 110, becoming the first state in the nation to decriminalize personal possession of illegal drugs. The goal was to redirect users to treatment resources instead of jail cells. But the pandemic slowed the rollout of funding. The state announced $270 million in grants to distribute, but as of today, only about $64 million has been allocated. During that slowdown, fentanyl-related deaths sped up in Portland.
The Oregon Health Authority really underestimated what it was going to take to distribute this amount of funds to this many organizations.
Oregon is currently the only state that has decriminalized drugs, but it's been proposed in other states, including Maine, Massachusetts, and Vermont. But not everyone is in favor of this first-of-its-kind law. Last month, the mayor of Portland pleaded for funding and demanded accountability. And other treatment providers collaborate in the search for solutions, knowing that drug abuse is at some point an inevitability for many.
A good public policy has some accountability, and it also has total access to treatment for people who are addicted. People are going to become addicted whether drugs are illegal or not. That is going to happen.
And across America, other experiments are also continuing. For example, right here in California, the state is getting a lot closer to passing a law which would create sites where people could actually get clean needles and use their drugs under the supervision of health professionals. The proponents there say that it allows them to be in a safe space where if they do OD, at least they're going to be around other people that could be there to save them. But opponents say that it's just another magnet for other addicts to come around and bring those drugs into surrounding neighborhoods. It's important to note that it is actually being rolled out elsewhere in the world, like Canada and Europe. They've seen some success also in New York City. Adrian?
Yeah, and then they've seen here in the States the backfire, the gateway to other drug abuse. Wow. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.